Welcome to East Alabama Today, featuring topics, events, and interesting people from all over East Alabama. Hosted by Carl Brady. Now, let's get right to the show. Here's Carl Brady.
Hello, everyone. Welcome into East Alabama Today. I'm Carl Brady. Thank you for being with us on today's program. As always, we'll start things off with a little contact information for you, get things going here with ideas on how you can get in touch with me. If you have an idea for the program, all you have to do is send me an email at cbrady@tv24.tv. We want to know about the things that are going on in your community and in your neck of the woods. So you guys are our eyes and ears out on the street. You have to let us know what's going on, and you never know, you might find yourself or someone you know invited to be a guest here on the program to talk about your special event. And we're talking fairs, festivals, things that are going on with your community club or group or organization, just things that are happening in your community that you think everyone else needs to know about as well. So again, send me those emails, cbrady@tv24.tv. We also want to know about the people who live in your community. Maybe you know someone who's a writer, an artist, or a musician. Maybe they have an odd or an interesting hobby and you think they'd be a great guest for the program. It's exactly who we're looking for. So send me information on them as well and send it to cbrady@tv24.tv. And remember, you can watch the program anytime you want to by going to our website, tv24.tv. There you'll find an on-demand tab. Click that tab, go down to East Alabama Today, and you can watch East Alabama Today shows that have been archived online for you to watch at your convenience. You don't have to wait for them to come back around on TV. Maybe you want to go and look at some additional information, or maybe you missed part of a show and you want to see the rest of it. That's all you have to do is go online to tv24.tv. We'll be back in just a moment, so stay with us. Welcome back into East Alabama Today. And today we're going to be talking about a topic that's rather confusing, so you'll want to pay close attention as we go through the program today. Let me first introduce my guest. It is Rita McMillian. Rita, welcome to the program. Glad to have you on the show with us today. And Rita is with Viva Medicare, and we're going to be talking about Medicare parts, Medicare supplements, all of those kind of things as the Medicare enrollment period rolls around again. It gets underway October 15th, is that correct?
That's correct, October 15th.
Mm-hmm. And how long does that last?
Well, the actual enrollment period, which is called the annual enrollment period, starts October the 15th and will end on December 7th. Mm-hmm. And that's when you can make your election for your 2015 insurance plan.
Mm-hmm. Okay, so we're going to talk about this, just kind of go from the basics of the beginning and see if we can find a way to understand some of the information about Medicare and Part A, Part B, Part C, Part D. So just start me off with exactly what is Medicare and who is it for?
Okay. Well, Medicare is actually a federal health run insurance plan. Okay. It is funded by the federal government. You pay into the system. People that are on Medicare are typically age 65 and older. However, you may have some people that are on Medicare that are under the age of 65 because they're on it due to some type of disability.
Right. And and I've always wondered this too. I've always not really understood the connection between Medicare and Medicaid. Medicaid is a state-run thing, and how does that work in conjunction with Medicare?
Okay. Well, Medicaid is actually, like you said, ran by the state. So depending on the state you live in, that is the state that will fund your program. Mm-hmm. It is for low-income families as well as low-income individuals. So if you live in the state of Alabama and you have Medicaid, you have Alabama Medicaid. Mm-hmm. And it is a health insurance plan.
It is. So we're talking about the federal version of Medicare. So this enrollment thing comes up. It's an annual enrollment period. You, I guess, just like any other insurance, you kind of look at it and review your insurance plan and decide if you need to do something different. Is that basically in a nutshell what we're talking about?
Absolutely. So many people are just confused about Medicare and what do I do and when can I do it. Now, if you receive any type of low-income subsidy or Alabama Medicaid, in addition to your Medicare, you can actually enroll in a plan at any time. However, for the masses, this is the annual enrollment period where if you're trying to make an election for a Part D drug plan or a Medicare Advantage plan, it has to be done during that time frame, which is October the 15th through December 7th. All of the information became available October 1 for the 2015 plans. So we're able to talk about that and share that information. It's online. I'll give several resources at the end where you can contact to get more information about it. But now is the time to pay attention.
Yeah, absolutely. So when we're talking about Medicare Part A, B, and C. Now, A, B, and C, those are things that you automatically get. When you have Medicare, you have those three parts, and then we're going to be talking about supplements to that. Is that how it works?
Let me clarify that for you, Carl. A lot of times you hear ABCs. What are the ABCs of Medicare? People who have Medicare cards, if they look at the card, there are two letters on the card. There's an A and a B. A says inpatient and B says medical. Well, what does that mean?
Right.
The Part A is what you get when you automatically turn age 65. That takes care of the hospital only. It does have a deductible. The deductible is $1,216. The Part B that's listed on the card that says medical, that takes care of your doctor's charges. For most people, unless they fall in a higher income bracket, it has a monthly premium of $104.90 that goes directly to the federal government. Okay, and then it does not include drugs. So in a nutshell, when you look at that, the Part B, the deductible is $147, and then you have a 20% copay. So if you don't do anything else, you could potentially have a very substantial bill in the event that you ended up in the hospital, because the A is only for the hospital and B is for the doctor. So when you talk about 20% of owing doctor's charges for all of their services, that could be quite substantial.
Yeah.
Now, when we talk about Part C and Part D, Medicare is full of acronyms, full of alphabets. What does all of that mean? Well, traditionally, your Medicare is just the A and B that I mentioned. I didn't say anything about D. D stands for prescription drugs, okay? Now, if you take on a Medicare Advantage plan, you get the A, B, D all in one, and it equals C, actually.
Okay, so since we're going all that, C is optional. What they call the Medicare Advantage plans.
That is correct.
And that is a supplemental insurance program. How does
Well,
where
let
does
me
that come in?
explain the difference. Well, people often get that confused as well. Now, if you take on a Medicare C plan, which is a Medicare Advantage plan, which includes the A, B, and D, it's not a supplement. You receive all of your benefits through the private insurance companies. All Medicare Advantage plans are subsidized by the federal government. That's the way that they work. Now, you don't have to get involved with the math. That's way over my head. And there are actually some zero premiums in your area, but you do have to do your research, okay? Medicare Advantage plans, the various things that you want to check. The government does approve for the insurance companies to have those plans, and you're not losing your Medicare. You're getting all of your benefits along with extra added bells and whistles through the private insurance company. So it's not necessarily a supplement. You receive your benefits through the private insurance company. Now,
that brings me the question then, if I'm already getting A, B, and D from the government, why do I need C to give me something I'm already getting? Well, what's the advantage? What's the advantage?
Let me tell you the advantage. D doesn't come from the government either.
Right.
Okay, the government does regulate the guidelines on the Part D, but Part D is also through the private insurance company as well. So if you only take Medicare A and B, and it'll give you that coverage that I mentioned, you don't have a drug plan. Your options are you can add on a standalone Part D drug plan, or you can take on a supplement to go along with that. Now, supplements, let's talk about supplements for just a minute. Supplements supplement traditional Medicare. So if you have Medicare A and B and you take on a supplement, it will pick up the cost after original Medicare. So if you take on a Medicare supplement, all of your claims will go to two places. First, they go to the government for processing, and then that 20% that I mentioned and your deductible, then all of that will roll over to your Medicare supplement to pay depending on what type of plan you took out. Now, your Medicare supplements, you're typically looking at much higher premiums than Medicare Advantage, and they don't include drugs. If it is not covered on traditional Medicare, then it is not covered on the supplement. When you look at Medicare Advantage, it combines everything into one. You could really save some money. Like I said, there may be some zero plans in your area. You do have to do your research. You will have co-pays for your services, but you're also going to get extra benefits that you won't get with just traditional Medicare. Some of the things that you may get may include some vision coverage.
Yeah.
You may have some type of dental coverage. And a lot of times if you're looking at a zero premium, if you don't go anywhere, you don't have to pay anybody. Everything is outlined and you know exactly what you have to pay based on the services that are rendered.
So if you're getting just a standard A and B plan through the government, is there a premium cost to that at all? We've already paid that over the life of our entire careers with paying the taxes on our paychecks, right?
That is correct, Carl, but let me tell you.
But there's still a premium to be
paid. Now, your Part A, you don't pay for most people. You don't pay. If you work the right amount of quarters or years, you automatically get your Part A when you turn age 65, or unless you're talking about a disability. Now, the Part B does have a premium. For most people, the premium is $104.90. It will automatically come out of your check. Now, and that goes to the federal government. Yes, you have paid into the system, but you do have to pay that Part B premium. In order for you to get any type of Medicare supplement or Medicare Advantage, you must have Medicare A and B. Because a lot of people think, well, I don't want to pay for B. What if I opt out? Well, catch-22. You're not required to take B, but if you don't take B and you just have A, you can't get an Advantage plan, nor can you get a Medicare supplement. And the other thing about the Part B premium, if you fall in a higher income bracket, then your Part B premium of $104.90 could be more than that. But for most people, they typically fall in the bracket of the $104.90.
So I get an Advantage plan or a supplement through a private company. That $104.90, is that going to be included in my premium and with the Advantage plan, or will I still have that separate payment? Will it be separated?
That's a great question. Now, a lot of people do get confused because if they take on a plan that does have a monthly premium, you have to pay that in addition to your Medicare Part B premium. So, good example. You take on a plan, it's has a zero premium. The government will take the $104.90. You'll never see it. But if you take on a zero option, there are no additional deductions or anything else for you to pay. Now, if you take on a plan that has a monthly premium, example, you took on a plan and the premium was $139. So you would pay that in addition to your Medicare Part B premium.
Okay, then that's making a little more sense. As you can tell, at 46 years old, I am nowhere near understanding this yet, but with parents who are getting up into that age bracket, we all need to start understanding this because we need to be able to help when they start making their decisions as to enrollment.
Well, absolutely. And even though you're 46 and we think that Medicare may not happen to us, there's always a possibility of a disability.
That's true.
That could have you entering into the Medicare world sooner than you think. So to stay informed is always good because there's always changes with the government.
Yeah. It changes every year or so, and the complicatedness of it is, I guess, aggravates everybody because you're dealing something with that is mostly for people who are getting on up in age, and then they have something this difficult to understand to try to figure out. But we're trying to help a little bit with that today. And as the open enrollment period comes up, we need to take our first commercial break. So we'll do that right now and come back and talk a little bit more about how to choose a plan and the things that you need to look at when you start the process of choosing a plan. So we'll do that in just a moment. Welcome back into East Alabama today. Rita McMillian is my guest, and we're talking about the Medicare enrollment period that starts October the 15th and runs through December the 7th. It can be extremely confusing, so we're going to try to talk a little bit and try to help clear things up for you some, or at least give you an idea of some things you need to know as you're making your decisions for whether to use a supplement, whether to get an Advantage program, whether to opt in for Part D, and which one to choose. And there's so much stuff to look at. Do you know how many plans? I think there are 10 plans that have been approved for the state of Alabama as far as Advantage plans go, I believe.
Well, let me explain it. There are several plans offered in different areas, but the best way to do that, if you go to the Medicare.gov website and you enter in your zip code, it will tell you what plans are available where you live. Yeah. Because what I found, you may get good advice wrong county. If you have friends that live in different areas, there are different things available depending on where you live. So the best place to find out that information, if you go to Medicare.gov and you enter in your zip code, it will narrow that down for you and tell you what's available where you live in that county.
Mm-hmm. You were giving me a nice analogy off the air of, for so many of us, insurance has not been that complicated of a process because most people get it through their employer. They have a couple of options that their employer's insurance company gives them, and you say yes to that one, and then you ignore it until somebody decides to make a change or two. But now, at this point with Medicare, you as the patient become responsible for your own choices, and there are so many more choices than we're used to having out there.
That's absolutely right. And one thing that I do is I do Medicare educational classes, and I teach people, to understand Medicare and what your options are. You're right. When you were working, your employer, they put together the insurance plans. They did all the negotiating. They decided what they would offer to their employees. And as we recall, you go to that meeting once a year. They may lay out 2 or 3 options on the table. Pick one, pick none, we're done, okay? But when you get to Medicare's world, that becomes your job. So typically when I host a meeting and we're talking about welcome to Medicare and I'm educating you, I'm really training you on your new job.
Absolutely. Well, let's start some of that training right now. It's the enrollment period. I need to make a decision. What are some of the things that I need to have in mind as I start looking at these things? My doctors, what doctors do I use? Are they in the plan that I'm choosing or I'm looking at? There's some important things to look at there.
Absolutely, and those are really great questions. And this is what I always tell people: make a checklist, okay? Make a checklist and write down what's important to you. Who are the doctors in the network? Is my doctor covered in that network? Are my prescription drugs covered on that plan? Are the hospitals in my area covered? Am I covered out of the country? What does that mean to me if I go out of state on that plan? There are just so many really great questions that you can ask that can be unique to you. Also, how much am I willing to pay in a monthly premium for a plan? Do I want copays versus no copays? So there are a lot of things you can make a checklist And if you attend a meeting or you're online, those are things that you want to look for. If you're talking to an insurance person about, well, what's important to you and is their plan a good fit? Those are some of the most important questions that I can think of that you'll want to ask. Because for a lot of people, changing doctors is not an option. And you may not have to change your doctors, but you always want to ask those important questions. Don't ever assume. Ask the questions that are important to you.
Yeah, absolutely. And this would be probably people will attend meetings and you'll hear different options and things like that, or you'll look at the options online and or read a booklet about it. But I think it would call the company that you're considering for your Advantage plan or your supplement and directly ask them these questions, because it may not necessarily be totally clear in the paperwork. So feel free, it's always good to ask direct questions of folks.
Absolutely, because when you're looking at information online or you're reading a pamphlet or you're looking in the Medicare and You booklet, all of those things really do start to run together. If you're looking at a handout, something that may be one sheet, it can't possibly explain everything that you want to know. So if you're looking at a particular company and you're interested, I always encourage people, don't assume, call that company and ask those questions directly. You may read something, you may have one interpretation of it, but it may mean something else. But if you call in and you get a live person, they will explain that to you so that you understand your options. One thing that I always tell people, you cannot make good choices if you don't understand your options.
That's true. What if I make a bad choice? What if I choose a different plan and then I get sick in March and find out then that my doctor is not in the plan, and I'm going to have to change doctors to someone who doesn't know me, who's never seen me, doesn't know my history? Can I change? Or am I just stuck? What's the option there?
Well, let's kind of break that up a little bit, because I always like to add in the part, if you're a person and you receive extra help, whether it's low income subsidy or Medicare Savings Program or Alabama Medicaid, you can change your plan at any time. Now, as far as, for the most part, during your election period is when you make your election for your plan. That ends on December 7th. January 1 through February 14th, if you have picked a Medicare Advantage plan during the annual enrollment period, at that point you do have the option to go back and operate under just traditional Medicare and a standalone drug plan. And you can add a supplement if you like, because supplements can be added at any time. But if you enroll in a Medicare Advantage plan during the enrollment season and you decide January that wasn't what you wanted to do, you have until February 14th to go back and operate under traditional Medicare, a standalone drug plan, and selecting a Medicare supplement if you decide to do so. But those are your options. Typically, the way that plans work, they run on a calendar year basis, which is from January to December. A lot of people get confused. They think, well, if I enrolled in December, or let me take that back. If I enrolled in July, then it goes through the next July. No, your new plans always start the first of the year.
So there is an option if you feel like maybe you've made a mistake, as long as you're in that January 1st to February 14th time period, to kind of go back and fix your mistake.
Absolutely.
As long as you do it within that time frame there. When I'm looking at the Part D parts and I find out that the most important medicine I take is not on there, but it's on another one, or how do I make that decision if I'm on like 10 different medications like most people who are 70 plus are, and do you just do the best you can and find the one that covers the most medicine that you have, or how do you figure that out?
Well, probably the best thing to do, Carl, number one, check your medications going in. Now, we never know what the future holds, but there are always exceptions that can be requested. There's different things out there. You look at a medication. If for some reason that your doctor says that you can't take what's on that list, it can be reviewed at any time. So don't ever think, oh no, I can't do it. There are options. Things can be reviewed. So it could possibly be approved. Now, the way that the Part D plans work, like I said, the government basically set up the outline of the plan. They said there are some drugs you must cover, some drugs you cannot cover, and then from there you can build your plan around it. Because sometimes people look at prescription drugs and things change every year and say, well, my drug was covered on my old plan. It's not going to be covered on the new plan for 2015. Well, on your current plan, it may not be covered on 2015 either. So always compare apples to apples because benefits change, drugs change, and a lot of times changes are made to help you, the consumer. Okay. And one other thing I would like to add, and there's some drugs that you may have had it in the past and it may not be covered in the future. They may not even make the drug anymore.
Right. Absolutely. We need to take another commercial break. When we come back, we'll talk about the actual process of enrolling and some places you can go to get more information about taking care of that. And we'll do that when we come back. Stay with us. Well, the final minute or so of the program, and just to give you some information about the enrollment process. Once you've talked to people, you've looked at the information, and then you have to actually make your decision about enrollment. But you can do that in several different ways, and there's a lot of resources out there.
Absolutely, Carl. And probably the best resource when you're trying to make a decision, you can call 1-800-AGE-LINE. 1-800-AGE-LINE and find out some options that are available to you. And once you narrow it down and you know what companies that you're interested in, it's probably best to give that company a call directly so that you understand the options that are available to you and they can check the things that are important to you.
Yeah, absolutely. And your local area council on aging in your county is a great resource as well to find out more information about the plans that are available in your county and how to get in touch with the folks responsible for those plans, and they can help you in many, many ways. Rita, thank you for being with us on the program today and helping to kind of clear this up and make it a little more understandable for us.
Well, thank you, Carl. I was glad to be here.
Absolutely. And folks, thank you for joining us as well here on East Alabama Today. We'll see you next time.